MAPS is actually medical autonomy precision surgery. So that's our aim, to realize the lag between the human surgery to the robot surgery. We know that robot has, to some extent, has more precision than the human, because human sometimes it has some hand shake, or which will generate more damage. But this problem could be easily solved by the robot. And for the surgery, especially for the eye clinic surgery, because human has some limitation, it can't feel even some force during the eyeball, because this force is very, very small. But as we have the robot has some force sensor, so this force sensor could easily also solve that limitations. So here, as I just introduced this robot, before we had the needle puncture movement, but this needle puncture movement, we know that during eye surgery we have a lot of different kind of the surgeries. So needle puncture, it's the very normal one, but we have to find more opportunity or possibility to add the function. With some telemonitor which has less ASIC problems, because if you set the decision totally within the robot, then how we make sure that robot is making the right decision. But first, the easiest way or the more common way to solve that is we can, for now, I control the robot within the keyboard, but we still have some other colleagues, they're designing joystick, which is more mimic like the movement of the surgeons. Yeah, they usually fix their elbow and just rotate a little bit with the wrist. So because my task is, I want to use the forceps to grab some small things, like we said, it's ILM peeling or ERM peeling. This small membrane, the thickness is very, very small. So normally the procedure is the surgeon will generate a small flap on the retina, but still don't want to touch too much on the retina. So the first step is very important. You just grasp it and rotate a little bit, generate a standing flap. So our task is how to safely approach this small flap. But since we human have some 3D perception, we can see this standing flap like a standing object there, and we can make sure this flap is between the two forceps. But as I did before, I collect some video before, and I feel if I just use one stream of the video, sometimes I feel my forceps is getting there and I grasp it, but when I close it, it shows the flap is just on the one side and I grasp nothing. So with this 3D system, so first we can see the two video streams before it fused, right? And when I do this grasping procedure, I can see from the two video, and this left video is, how to say, less information, and I will check the right. But with this device, still this device has some fusion function, and I see it feels like just I used the microscope, and I think this function could be used. We see here the surgeon is just sitting on the patient, so it's in presence surgery. But in the future, we may realize the function that the surgeon is in some other country, and he teleoperate or telemonitor the robot in another country. But how could he or she knows the 3D perception. So with this device, we can easily capture some data and transfer to the surgeon.